You
Sure,
will
sir.
speak the reality. If at all something wrong from my side, I am ready to correct. Okay.
No, sir.
And
You always.
no, 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 no. And I'm not a perfect man. Okay. So there
It's
may
your.
be some mistakes, and if the points, if they are not clear, so please let me know, and let my colleagues ask me the questions, and I'm very happy to answer.
Yes, sir. Anyone
And
have any
I miss your anchoring during your undergraduation.
Thank you, sir. Thank you for
You took
remembering me.
time to, huh? Yes.
Thank you, sir. Thank you so much.
Okay.
So I would like to request participants to take, if you have any questions, kindly raise your hand, so that sir will be answering your questions directly. Otherwise, you can type the question in your in the chat box. Sir, there's a
Yes, there is one question from Dr. Hemalata.
yes,
Please
please.
highlight the treatment of Basti. Okay. So
Yes, sir.
directly Basti may not help. I told you have to do Satyavamana first because the Vishma Avarana is clear, then you have to go for Basti. I tell you the Basti, I have listed the Basti ingredients. And Basti ingredients are Estimadu Fanta, Mahatiktaka Grita. So first is Saindava, very traces Saindava because Saindava, Madhu, they cause the Lekhana karma. So we have to use less Lekhana here and reduce the percentage of Lekhana Dravyas. So 30 ml, I use uh, Madhu, 5 grams of Saindava, and then 60 ml of Mahatiktaka Grita, and then 350 to 380 ml of or 400 ml, nearly 400 ml of this Estimadu Fanta, and 10 grams of Indrayava. Fine Indrayava Chuna, that is Kalka we have to prepare, and that Kalka is added. And every day this basti only we have to give. Dr. Hemalata, is it clear?
Yes, sir. Thank you, sir. And please highlight about Picha Basti also, sir. And how often should we give?
Pichabasti,
And
see, Pichabasti I used, I have not found the results.
okay,
I have not found the results with Pichabasti.
okay, sir. Sir, this for how many days we should give continuously, and how
8
much
days.
gap, and
8
again
days.
then repeat it, sir.
8 days you can give, and if the disease is very severe, after 15 days you can repeat.
After
And if
15 days, again for 8 days, sir.
8 days, 8 days.
Thank you, sir.
Here
Sir,
the
how about
result.
purpati, sir? Use of
Ah,
purpati.
yes. Use of Parpati. See, in Grahani we use Parpati. Here also you can use Parpati. You get Kutaja Parpati, you get Panchamrita Parpati. So Parpati purpose Kajjali, what we use, Gandaka. Actually, Rashastra people also might be here. What I would like to make clear the point here, Gandaka Shodhana is told in two dravyas. One in Godugda, often it is used. Another is we have to do Shodhana in Bringaraja Swarasa. So Parpati Kalpanartha, the Gandaka did Shodhana in Bringaraja would be very beneficial to correct the Agni. Okay, that is why Bringaraja they have told. Bringaraja Asava is mentioned in Agni Mandya and in other this Agni related diseases. Okay, so Parpati also you can use, but I made very simple this Kutajaganavati, Sutsekara or this, and Yashtimadu Chuna you can give. Yashtimadu Chuna you can give.
Sir, how about Kutaja Arista and Mustaka Arista, sir?
Arista don't use. Arista don't use. Arista is Amla Rasa. That is not going to help. Arista will aggravate Pitta dosha. That is why don't use Arista in Raktatisar. In Pittaja Grahani, in Pittaja Atisara also don't use Aristas.
Sir, if it is a non-bleeding thing, we can use.
Non-bleeding you can use, but you see some people by taking aristas, they develop pain abdomen, amala belching. So if you observe these symptoms, and then you immediately have to stop.
Thank you, sir.
See, I have not used any investigations here.
Yes, sir.
Nobody asked me about investigations.
Sir,
Maybe
also
time is
highlight
more.
about
So
Rasayana, sir, after Rasayanas.
Rasayanas, no, madam. Rasayanas, because Agni is not correct. And if you give Rasayanas need proper Agni,
Yeah,
then
definitely.
only they will be helpful. Better don't
That's
use
what.
Rasayanas. And
After
if
the
at all,
treatment, sir.
after the treatment, when everything goes normal, see the effect of your treatment, you have to assess with formation of the stool. If the stool is started forming, then your treatment is effective. If
Yeah.
has not formed, then your treatment is not effective. This is the best way to assess. Okay.
Yes,
After
sir.
3 months or 6 months, when stool is proper, so then you can use Amalki Rasayan. Best is to give Amalki Rasayan.
Thank you, sir.
Okay.
Thank you, sir. Thank you so
And
much.
yes, I was talking. If you have a time, I want to clarify one more point here.
Sure,
I
sir.
have not, I have not talked and used investigations here. Am I correct?
Yes, sir.
Yeah.
I wondering actually. Yes,
Yeah,
sir.
there
Yes,
is
sir.
one question, sir. Colonoscopy, scope of colonoscopy diagnosis. And I
All
just joined.
patients who come to you already diagnosed patients, they come. They come with a big file. They come with a big file
Yes.
already. Yes, as an academician, I would like to recommend you a colonoscopy, confirm the diagnosis, and when the stool started forming, and then you can go for another colonoscopy so that you can have a documentary evidence. So now people want evidence based science, so this is the document. Okay. And if you do ESR, simple ESR, so ESR will be high, CRP will be high. If patients are on steroids, they come down, but when you stop again, they raise. Okay, one thing. When you do CBC, total count will be high because of mixed infections, anaerobic infections. It will be high. So to diagnose Ayurvedic disease, there is very less need of investigations. This is the message I wanted to convey. You spend some time with the patient, elicit the history, talk with the patient, do examination, and come to a conclusion. This message I wanted to have. That is why I have not mentioned investigations. And to diagnose avarana, there is no investigation. Is it not?
True, sir.
Yes. Okay. Some other question? Senior most sir is there, Dr. Irrigation sir.
Yes, sir.
Sir,
Yeah,
from
please.
your side,
Thank you, sir. Thank you so much.
Vinuta has asked, what medicines can be used in patients suffering for fatty degeneration of liver? Is it? That question has gone before I read the last word. So fatty degeneration or fatty infiltration.
Hello, hello, sir.
Ah, yes. Can
Sir,
you repeat
fatty
it?
degeneration. What medicines can be used in patients suffering from IBS and also having fatty degeneration of liver, sir?
So the same line of treatment you can use for fatty degeneration. You check what hepatotoxic drugs patient is taking. Withdraw those drugs. One. Second, patoladi kashaya. See, patoladi kashaya comes, patola muladi kashaya comes, patola katuki rohinyadi kashaya comes. All are having patola as an ingredient, but all three have different indication. Kevala pittaja, they use patola. पटोलादि कषाय. पटोल मूलादि कषाय मलभेदना you have to do पटोल मूलादि कषाय. पटोल पित्त निस्सरण when you want to do पटोल कटुकी रोहिण्यादि कषाय. Okay, so this is the difference and I recommend here पटोलादि कषाय. Okay.
Okay, sir. Thank you.
Yes.
Thank you, sir. Any other questions? Any other questions regarding
Praveen,
lactatiside?
Praveen Patil,
Yes, I
Praveen?
am here, sir.
do you have questions? I think you have questions.
Sir, I would like to ask about the statoria. So, pathology is somewhere not in the colon, like in the pancreas, somewhere
Hmm.
else, but sometimes they do come with the bleeding disorders in the later
Hmm.
stages.
Hmm.
So, pathology is not in the colon, but it is somewhere in the systemic. So, and at those conditions, how to approach, sir?
See, in case of cirrhosis of liver, in case of, especially in case of cirrhosis of liver, and splenomegaly, okay, so in there prothrombin timing is altered. You have to go for CTBT and prothrombin time. Sometimes as a proctologist you will have bleeding piles, you will have bleeding piles, uncontrolled bleeding piles, and whenever you take up that for a surgery, and during surgery also there is heavy bleeding, and when you investigate prothrombin timing is something like 4 above 15. 15 you can take up for surgery, no problem. 17, 16, 17 would rather cause a difficult during surgery. And sometimes a small pustule or a wound will be there, from there bleeding starts. And I have come across one such patient, a bleeding from the calf region. I thought it is a varicose ulcer, but there is no varicosity, but there is small wound, and patient scratched the scale and it started bleeding, and bleeding was there for 15 days. So this bleeding we have to treat with Patoladi Kashaya, Kamadugo with Moktika, Raupe Basma, and Godanti Basma. This you give for 15 days and CTBT will come down, and then you can take up for surgeries. And this statoria will also come down when there is no pathology in the colon, but there is pathology somewhere in liver or spleen. So this you can see and confirm the effect of the treatment by repeating CTBT and prothrombin timing. Always you have to go for prothrombin timing, PTI.
Thank you, sir.
Yes.
Thanks for once
Sir,
again. Thanks for great presentation, sir.
Dr. Hemalata,
yes, sir. Namaste, sir. After undergoing operation colostomy,
hmm.
the same type of treatment should we do, or is there any difference in treatment, sir?
Grahani patient. One more question somebody asked. So can you repeat Hemalata?
Sir, namaste, sir. Sir, after undergoing operation colostomy, and they'll come with the bag and all those things, the same treatment can be given, or is there any difference in the treatment, sir?
I think there is a problem in network from sir's side.
I'll try.
Sir, again, there is a problem in the network from your side, sir.
See, for what? Yes, now it is I think audible. Cause for the colostomy. Dr. Hemalata,
Now audible, sir. Yes, sir.
cause for the colostomy, I know.
Himalata, madam, could you please unmute and
See, colostomy you cannot give basti. and basti from where you give, and colostomy. So already patient either CA or CA rectum, CA
Yes, sir.
after undergoing surgery. Okay. So now surgery is not done for ulcerative colitis. Usually they go for radio ablation. Okay, radio ablation, the hyperemic area in the colon, they are going to coagulate with the laser, and thus they reduce the bleeding. Sometimes it heals, sometimes it may not heal. But that would not give the solution, and they give the steroids as a final resort. So post usually surgery is not done for ulcerative colitis nowadays. It was there before, but how much one part you resect and after few days ulcer appears in another part. So surgery would not serve the purpose. So
Thank you, sir.
colostomy you can manage with the shamanaushadis. Already patient has undergone colostomy, you give shamanaushadis. Hope your doubts are clarified.
Thank you, sir.
I think Dr. Vinyasa had raised the hand. Dr. Vinyasa?
Ah, yes, doctor.
Dr. Vinyasa, would you like to ask question? Vinyasa, madam? Until then, I'll be reading one more question from the chat box, sir. Uh, what to give? What to give?
You can read chat box. I'm not able to.
Sure, sir. I'll be reading, sir. Sir, what to give Grahani patient with the flatus during evening time? It's simply gas, no smell.
Simply gas, no smell. Okay.
No foul smell.
Pain abdomen. Usually pain abdomen is there. So such patients with Shankavati, Kutajaganavati, and these would serve the purpose. But meanwhile, you have to see whether patient is having the tongue coating, heaviness, and what kind of digestion. Whether the food is digested or patient is having loose stools. The patient is having loose stools, and Shankavati would help to reduce the flatus. ಈ ಶಂಕವಟ್ಟಿ ಅಂದ್ರೆ ನಮಗೆ ಮೊದ್ಲಿಗೆ ಒಂದು ಹಾಜ್ಮೋಲಾದ ಅಡ್ವರ್ಟೈಸ್ಮೆಂಟ್ ಬರ್ತಿತ್ತು, ನೆನಪೈತೆ? ಆ ಇಂಜನ್ ಒಳಗ ಹಾಜ್ಮೋಲಾ ಗುಳಿಗೆ ಹೋಗ್ಬಿಡ್ತೈತಿ, ಇಂಜನ್ ಟಸ್ ಪುಸ್ ಟಸ್ ಪುಸ್ ಅಂತೈತಿ. ಓಕೆ, ಸೊ ಹಂಗ ಈ ಶಂಕವಟ್ಟಿ ಕೊಟ್ಟು ನೋಡ್ರಿ, ಲೈಕ್ ದಟ್ ದೇ ನೋ ಲೂಸ್ ಟೂಲ್ಸ್. ಓಕೆ, ಶಂಕವಟ್ಟಿ ಫಾರ್ ಹಂಸವೇಣಿ ಮೇಡಮ್, ಶಂಕವಟ್ಟಿ ವಿಲ್ ಸರ್ವ್ ದಿ ಪರ್ಪಸ್. Don't give Shankavati before food, during food or after food.
Yes, sir. Yes, sir. Thank you, sir. Thank you so much. Any other questions? If anybody want to speak, I think they can unmute the mic, and they can ask questions. Hoping all doubts are cleared. Yes.
Dr. Savitri, we have taken a great task of arranging this webinar, and
Sir, I
I
want.
wholeheartedly congratulate you. In fact, Praveen, he was asking me repeatedly, and I could not give him a proper date. And when he started asking me, probably he might be angry. Then Adur, Viresh Adur, give me every day he used to ask, and today it is possible. And actually, since yesterday I'm having fever. So today also I'm just, but I did not wanted to postpone it. I wanted to finish today in the stipulated date and time. So thank you very much for patient listening and interacting.
Thank you very much, sir. For it's really our privilege that you are here into our Alumni Talk 2025, sir. Getting your appointment was really a difficult task because you are such a busy person and a very well-known practitioner. We have seen you always being a good practitioner, sir. So I really thank wholeheartedly from behalf of our alumni, Millennium Batch alumni, sir. Thank you so much. And I thank all the participants and especially our alumni secretary, Dr. Praveen, Dr. Veeresh Adod, and our technical support from Dr. Praveen, and all our Millennium Batch alumni for supporting us and making this event so successful. And we want our alumni to shine pan India, pan world. So, with this intention, we are trying very hard to make our college name to be shine everywhere, sir. So this is our motto. With these few words, I would like to wind up the session. Any other suggestions from your side are wholeheartedly welcome, sir.
No, it's going very well. And I also need to attend all webinars. Okay. I could not attend it, but now onwards I must.
So thank you, sir.
And
We really
I also could get opportunity to learn from others.
thank you, sir. Thank you, sir. Thank you so much. We are very happy to see you. We'll be seeing to see you in all the webinars, sir. Thank you so much. People like you should encourage budding doctors, sir. So we really want you to stay in all the webinars, sir.
Thank you.
Thank you, sir. Thank you so much. Thank
Good
you
night.
all. Yes,
Good
sir.
night.
Good. Thank you. Thank you, sir.